Have you got breast cancer like me and you're blaming yourself? Or do you worry that you might get breast cancer in the future? Are you scared that you'll get it because your granny did? If that's you, then this video will help put your mind at ease. I'm going to let you into a secret. The biggest risks for getting breast cancer are out of your control. There is nothing you can do about them. There are some things that you can control, and I'll go through all of those in turn. And as a bonus at the end, I'll cover the 3 things you can start doing today to reduce your chance of getting breast cancer in the future. I'm Dr. Liz O'Riordan. I'm a breast surgeon who's had breast cancer, and I do the research so you don't have to. Make sure you hit the subscribe button so you don't miss next week's video. So, why does breast cancer happen? The simple answer is that we still don't know what triggers a healthy breast cell to mutate into a cancer cell. We do know that around 1 in 10 breast cancers are linked with faulty genes, such as the BRCA1 and 2 genes. And these can either be passed down from your parents, which means the gene changes are in all your cells when you're born, or it can happen spontaneously, so you could be the first person in your family to be affected. However, there will be genes that haven't been discovered yet, and this means that if several people in your family have had breast cancer at a young age, it might be due to a faulty gene, but it wouldn't show up on a genetic test because we haven't discovered it yet. What about the other 90% of breast cancers? Well, it's all due to mutations in your DNA that happen over time. For a cell to become a cancer, certain changes have to happen in the right order. And when they do, that cell will keep dividing and growing without being killed. It develops its own blood supply. It has the ability to move through tissues into the blood and the lymph nodes. And that means it can start to invade other structures. Most of the time, these mutations are picked up by the cell when it tries to divide. The cell knows that the DNA is faulty and it kills itself. But if mutations happen at certain checkpoints, like a red traffic light being permanently switched to green, that cell keeps on growing. Some of these mutations may be due to cancer-causing chemicals like nicotine and alcohol, but a lot of them are just random. They simply happen. They are more common in older people because their cells are older and they've had more time for mistakes to happen when the cells naturally divide. And that's why so few teenagers have grey hair, for example. So what is your chance of getting breast cancer? 1 in 8 women will be diagnosed with breast cancer in their lifetime, but that also means that 7 out of 8 women won't. Researchers have identified hormonal, lifestyle and environmental factors that may increase your risk of breast cancer, but it's not clear why some people who have no risk factors, like me, develop breast cancer, yet other people with lots of risk factors don't. It's likely that breast cancer is caused by a complex interaction of your genetic makeup and your environment. The 2 biggest risk factors are being a woman and getting older, and both of these are out of your control. Breast cancer is 100 times more common in women simply because we have more breast tissue. When you're young, your risk is very small and it increases as you get older. 85% of women with breast cancer are diagnosed over the age of 45, and almost half the cases are in women over the age of 65. In your 30s, the risk is 1 in 200 or 0.5%. In your 50s, the risk is 1 in 40 or 2.4%. And by the time you reach your 70s, the risk is 1 in 24 or 4%. And it's really important to keep these percentages in mind when you read a scary article that says, for example, that eating processed meat can double your risk of breast cancer. If you're 30, that means your risk goes up from 1 in 200 to 1 in 100. It doesn't mean that you have a 50-50 chance of getting breast cancer. What about dense breasts? If your breasts are dense, this may increase your risk of getting breast cancer. And at the moment, there is no clear scientific evidence to explain why this happens. A lot of the researchers looked at large groups of women and found that those with dense breasts were more likely to get breast cancer than those who didn't. But this doesn't necessarily mean that having dense breasts alone causes breast cancer. And there is nothing you can do to make your breasts less dense. It happens naturally as you get older, especially around the menopause. But even then, some older women do have dense tissue into old age. And it can also make it harder to see a cancer on a screening mammogram. What if you've already had breast cancer? Well, if this is you, like me, and you've had cancer in one breast, you are more likely to get a cancer on the other side. But remember that the treatment you've been given for breast cancer reduces the chance of that happening. And you'll get follow-up mammograms every year for the first 5 years, just to pick up any early changes. What if you have busy breasts? So some women are diagnosed with things like atypical ductal hyperplasia and lobular carcinoma in situ after a breast biopsy. These are not cancerous changes, but they do increase your chance of getting breast cancer in the future. Your doctor will discuss treatment options and screening with you, such as drugs for chemoprevention and having more regular mammograms. What about estrogen? Well, there are certain risk factors that are related to your lifetime exposure to estrogen. Estrogen doesn't cause breast cancer, but it does encourage ER-positive breast cancer cells to grow. The theory is that over your lifetime, if you've been exposed to more estrogen, then there is a greater chance that a rogue breast cancer cell could be stimulated to grow. Your ovaries, where your eggs are stored, begin to produce estrogen when you start puberty, and they stop producing eggs when you reach the menopause. Your risk of developing breast cancer may rise slightly with the amount of estrogen your body has been exposed to naturally over your lifetime. For example, if you started having periods before the age of 12 and you didn't get to the menopause until after the age of 55, you've been exposed to more estrogen over a longer period of time. And this is out of your control. But there are some lifestyle factors and personal decisions that may increase your risk, and these are also related to your lifetime estrogen exposure. Now, the increase in risk for all of these following factors is very small, and it should not be a reason to make a decision about whether to have children, to use the pill, or HRT. Observational studies have shown that being pregnant and breastfeeding decreases your risk, whereas never getting pregnant or having children in your 30s can increase it. And the risk is slightly higher if you've used oral contraception or HRT for more than 10 years. And see this video for more info on the pill. Is there anything we can do to stop you getting breast cancer? Sadly, the answer is no. Even women with a BRCA gene who have the healthy breasts removed still have a very small chance of getting breast cancer. And that's because it's impossible to remove every microscopic cell during an operation. So what can you do to reduce your risk? There are 3 things that have been shown to have a big impact on your risk of getting breast cancer, and you can make a start on all 3 of them today. Number 1, cut down on the amount of alcohol you drink. Alcohol is a grade 1 carcinogen, and that means it directly stimulates cells to become cancerous. It can also increase the amount of estrogen in your body, which can encourage breast cancer cells to grow. You shouldn't be drinking more than 14 units a week if you're healthy, and if you've had breast cancer, the guidelines state that you shouldn't have more than 5 units of alcohol in a week. Number 2, maintain a healthy weight for your height. Now, this is really hard to hear, and trust me, it's even harder to talk about, but there is evidence to prove that being overweight does increase your risk of getting several cancers, and one of those is breast cancer. Now, I'll be doing a video to explain this in more detail shortly. Remember to subscribe so you don't miss it. If your weight isn't in a healthy range, it is worth taking steps to change this if you can, and not just for your cancer risk, but for your heart health as well. And I can't imagine how hard this is to hear, but these are the facts. And maybe your GP or your family doctor could give you some sensible advice about how to start. And finally, number 3, exercise 5 times a week. There is more and more evidence to show that people who don't exercise regularly are more likely to get cancer. And if they have cancer, their cancer is more likely to come back. We should all be working out 5 times a week with a combination of weight-bearing aerobic activity and resistance training. And again, I know it's hard, and I've struggled to do it when I'm having a tough time. But then I look at how many hours I spend scrolling on my phone or watching Netflix, and I know deep down I could do it if I really wanted to. Plus, it's one of the few times I just feel like Liz and not a cancer patient. If you've got any more questions about what causes breast cancer, let me know in the comments and I'll do a video on them. I'm Dr. Liz O'Riordan, and thanks for watching my channel.